Hello, this is spine specialist Dr. Sangho-Lee. Today, I'm going to talk about why lasers are used when treating cervical and lumbar disc diseases in spinal surgery. Also about why lasers are more delicate and accurate when used. I was the first in Korea to use holmium-YAG laser and CO2 laser in 1991 for treating the spinal disc disease. The holmium-YAG laser is a laser used when performing endoscopic surgery. The CO2 laser is a laser used when performing microscopic surgery. First, let me tell you about the microscopic laser. When we perform a surgery, we use a stainless steel scalpel knife. A surgical knife this size is very big to use. Therefore, the wound area should be large so that you can see the lesion area well. It's inevitable that there's a lot of damage to normal tissue in order to use this surgical tool. But the laser is as thin as a hair. It is a laser as thin as a hair. So it is 100 micron, 0.3 millimeters. Very thin light of 300 microns can easily enter through this hole. It can go through this little hole. It's a laser knife that can quickly go through this little hole. Surgery with a laser knife is much more accurate than this scalpel knife. You can't see these fingerprints. But if you look through a microscope, you can see them all. You can place a dot between these fingerprints without damaging them at all. This is a carbon dioxide laser or CO2 laser. Posterior longitudinal ligament located behind the disc. The ligament should be as thin as paper, but there is a disease where it becomes this thick. If you try to remove it with forceps or a stainless steel scalpel, it can be dangerous because the spine is located in the neck. However, if you look through a microscope with a shield behind the posterior longitudinal ligament and shoot the CO2 laser one by one with precision, you can accurately remove the thickened ligament and avoid damaging the spinal cord at all. Especially when performing surgery for cervical disc disease, there is a procedure called foraminoplasty to preserve the disc. Among the spine, the cervical disc is very small. What should I do if I try to treat the disease while keeping the disc that acts as a cushion between the small cervical discs? A very small hole of the cervical spine. A very small hole is made with a diamond drill using a high-speed drill, about the size of your little fingernail. If you make a hole as small as your little finger, you won't be able to insert a large surgical instrument. Nothing will go in. Only the laser can go in. The hair-thin laser flies through the air and enters, so even though it is a very small hole, it can accurately vaporize and eliminate bad disc disease. Among lumbar disc disease, it is called lateral lumbar disc disease. The outermost part of the disc. In the case of an outer lateral disc, if this is a nerve, the disc is right here. The disc is sticking out right next to the nerve. It is very difficult to insert a scalpel for surgery. There is also a possibility of damaging the nerve. However, there is a disc like this under the nerve, and this is where the laser is fired. It is 0.3 millimeters. It is possible to remove bad disc fragments by accurately shooting one shot at a time while completely protecting the nerves. We have published a lot about spinal disc surgery using CO2 laser in international journals and medical textbooks in English and published it in medical textbooks. Shooting a laser is very difficult. If you use a stainless steel knife carelessly, people will get hurt. A laser is also a knife of light, so it must be used very precisely and safely. So, you need to train. When the doctors join at Wooridul Spine Hospital, they receive an apple for the first thing. Then they practice engraving his or her name on the apple. They can use the laser after sufficient practice. Microscopic lasers provide precision and safety for spinal disc disease surgery while protecting nerves well. And accordingly, the results of the surgery are very good.